Does size matter? Breast implant size depends on different factors. So when a patient comes to me asking me for 420cc gummy bear implants, I always explain to them it doesn't exactly work that way. So kind of scientifically speaking, the volume of an implant is a three-dimensional thing. And these dimensions depend on our patient's body composition. So we have a base, a height, and a projection of the implant that will vary depending on the anatomy of my patient. So deciding on the size of a breast implant, the first thing we do is taking the measurement of our patient's chest base and height. Now with that, we'll have more or less this surface area that we're gonna decide on, and we're gonna have a range of different options on this same surface area. So the third dimension we're gonna look at is the projection. The projection is how much the breast implant will protrude from the chest wall. So if a patient that we already have the base and the height tells me, no, I want my implants to look like this, like super protruded from the chest wall, I'm gonna choose a higher profile, which is our corset implants, versus a patient who just wants like a more round shape and doesn't want their implants to show that much. I would use maybe a demi projection. So next time you go on a consultation with your plastic surgeon about breast augmentation, rather than telling them the breast implant size your best friend had, you have to tell them your expectation. You have to keep in mind that the idea is for them to have similar body compositions as yours. That way you can have an idea more or less on how the implants will look on you. If you have more doubts about breast implants, how to choose them, how to choose the best surgeon for you, let us know on the comments below.